back. Now, cancer is a topic that rightly or wrongly scares us all. And that's not surprising when you realise that half of us will be diagnosed with cancer at some stage in our lives.
Yes, and despite incredible medical advances over the years, cancer still accounts for 3 out of every 10 deaths in Australia. So, while research into treatment continues, there's increasing focus on early detection and intervention.
Yeah, and to help explain this exciting frontier, we're joined by Dr Elana Gance. Nice to have you back with us, Doc.
Thanks for having me.
These numbers are staggering, aren't they? I mean, why is cancer such a problem in Australia?
So they say there's going to be 134,000 new cases of cancer diagnosed in Australia this year.
Wow.
And it's going to be up to 150,000 per year in 2020. So massive, massive numbers. The important message with all these cancers is generally if we can catch them early, we've got much better chance of treating it and much better chance of cure.
Well, that's what I was going to ask. What stages of our lives do we start doing the tests, and what cancers can we test for?
So the stage is really dependent on your individual risk factors, but for general population, the earliest one we screen for is cervical cancer. So you and I had that at 18, but really exciting news, there's been a new development and we can be much more accurate now and pick it up much earlier. So girls don't need to start screening till they're 25 years old now.
Lucky girls.
Yeah, and it's every 5 years rather than 2 years, which is also awesome. So related actually to a discovery in Queensland, which is pretty cool, of the virus, which is what the young kids are getting in the injections for.
Yes.
Yeah.
Okay.
See, because my mum passed when she was 50 of breast cancer, so I know that the doctors say you don't need to start testing from 40. I do it every year now just because I'm diligent. Do you suggest that, or are you just kind of like whatever makes the patient feel comfortable?
So if you have individual risk factors, so strong family history or other diseases that might increase your risk, then you really need to discuss your individual circumstance with the doctor.
Okay.
And you need to feel happy with what you're doing. Over-screening can have some problems. Sometimes we diagnose things that aren't necessarily a problem.
Right.
But under-screening is really where the big problem is because, you know, if the population doesn't screen, we don't pick things up. So the general recommendation for mammography, so for breast cancer picking up, is the age of 50, but that's if you don't have a family history.
Right.
Yeah. And so if you do that every 2 years, Breast Screen Australia thinks that we probably decrease breast cancer death by about 21 to 28%. So massive, but you need to go. It's uncomfortable, I know, but it's important.
I mean, to the government's credit, there's a massive screening progress in place. You mentioned the breast cancer, for bowel cancer as well. Everyone's sent a kit on their 50th. It's an easy test to do and send back, as we know. The earlier you catch these sort of things, this is the key, right? The earlier you catch it, the better your chances.
Yeah. So for bowel cancer, if we catch it early, we can actually treat successfully 9 out of 10 bowel cancers.
It's amazing.
The problem we have is that I generally ask my patients about their birthday present, and they're one in the mail, and it's generally in the laundry or in that top drawer. So listen, it's not going to detect anything there. No, you need to actually do the test. So in the privacy of your own home, 2 samples, send it back in the mail. And if it's positive, it doesn't mean you have cancer, but just means you need to have that conversation and get some further testing.
So what cancers can we test for and which ones can we not test for?
So in order to be a good screening program, you need 2 things. You need to be able to pick it up, so there needs to be early things that we can pick up, but also we need to know that that makes a difference. So there's some that we don't have any testing for. So unfortunately, lung, pancreas, like some of those cancers have made little advances in, we don't know how to pick them up early.
Yeah.
Others we can pick up early, but we don't actually know if it makes a difference. And a big one there is prostate cancer.
Yeah.
So that's one that you need to discuss individually with your doctor and work out what's right for you.
All right. I mean, there are rare cancers too, but there are some of the big ones that we need to screen for. And the way you can help, if we get this right, remind yourself to go to the doc, remind your friends to get tested and stay on it as well. So that sort of info could save your life. Doc, nice to see you again. Thanks so much.
Thanks so much.
Dr Elana Gance with us here on the House of Wellness.